Greetings and welcome back. This is Iris Heath, licensed clinical professional counselor. I'm coming to you today to talk about attention deficit disorder or attention deficit hyperactivity disorder, ADHD, ADD. So I'd like to just go over this information. The resources are from NAMI, the National Alliance on Mental Illness. You can find this information at nami.org and just put in ADHD. So I'd like to go over some of the symptoms and some of the findings. So attention deficit hyperactivity disorder is the information that I actually pulled. So it states that it's a condition in which characterized by inattention, hyperactivity, and impulsivity. It is mostly diagnosed in young people, and yet both adults and young people can have a diagnosis. It gives an estimated 8.8% of children aged 4 to 17 have ADHD. While ADHD is usually diagnosed in childhood, it does affect adults. Approximately 4.4% of adults 18 to 44 years of age have ADHD. It states that with treatment, like most mental illnesses, and I'm saying most mental illnesses are treatable, even if they're not curable. With treatment, people with ADHD can be successful in school, work, and leading productive lives. Researchers are using new tools such as brain imaging to better understand the condition and to find more effective ways to treat and prevent ADHD. So some of the symptoms include, but are not limited to, signs of inattention include becoming easily distracted, jumping from activity to activity, becoming bored with a task quickly, difficulty focusing attention or completing a task or activity, trouble completing or turning in homework assignments, losing things such as school supplies or toys, not listening or paying attention when spoken to, daydreaming or wandering with lack of motivation, difficulty processing information quickly, struggling to follow directions. And keep in mind, some of these are just regular childhood things. And so the article does speak about that. Signs of hyperactivity include fidgeting and squirming, having trouble sitting still, non-stop talking, touching or playing with everything, difficulty doing quiet tasks or activities. Signs of impulsivity include impatience, acting without regard for consequences, blurting things out, so not being able to wait your turn, not being able to raise your hand and wait for the next person to give their response, difficulty taking turns, waiting or sharing, interrupting others. Some of the causes that are given: genetics. Just like with most mental illnesses, there is research that shows that individuals and families have ADHD. So if you know that someone in your family has been diagnosed with ADHD and you are exhibiting some of these symptoms for a period of time, again, there has to be a specific criteria. That's the reason I ask for you not to diagnose yourself or to diagnose others. This is information. So keep in mind, this is for informational purposes only, and yet the information may be something you can take to your doctor, your therapist, to help with them being able to either helping you manage your symptoms, helping with a diagnosis, helping to rule out. Sometimes we use information to rule out something. So it's also stating environmental factors. Studies show a link between cigarette smoking and alcohol use during pregnancy and children who have ADHD and exposure to lead. Yes, so lead paint as a child has also been shown to increase the likelihood of ADHD in children. There's a reminder about ADHD is usually diagnosed in childhood, and yet it also can be diagnosed as an adult. Keep in mind, I'm seeing more things stating that there are a lot of business people who are actually discovering that they have ADHD. It also states that the treatment can include, again, it may include medications, behavioral therapy, self-management, education programs, and assistance through schools or work or alternative treatment approaches. So individuals who I've had the honor of working with have actually done well with developing routines. Routines such as getting up each day, doing the same thing, as far as getting up, doing an exercise program of some sort, whether going to the gym, walking, running, whatever seems to work well for you. Writing down at the beginning of the day what their tasks for that day may be, and being able to stick to their tasks. Once they recognize that they're off task, being able to look back at their routine, their written routine, has been beneficial. Again, it's a refocusing that needs to be done. So when there's a notice that there's a shifting or moving away from things, it's a re-engaging. Being able to have that list in front of them or somewhere where they can redirect themselves from time to time to see that list has been really helpful or useful. Keep in mind, if you do have a diagnosis and you are, whether in school or taking particular classes, you may have to let someone know so that you can actually receive additional assistance, whether it's additional time to complete an assignment or additional assistance from someone in your library, someone in the program. So there are different things set up for individuals, and it's maybe helpful for you to ask for help if you need to do so. Like all of our programs here, I hope that this has been helpful. I hope getting this information is something that is helping you to be able to do life well. So be well, be encouraged. I'll put the information about NAMI in the description. And again, look for resources. There are tools and there are things that people are using, such as I stated earlier, cognitive behavioral therapy, which we call CBT. And there are individuals who are able to, again, complete tasks and be able to do as the article is stating, to be able to go on and have lead productive lives. So I wish you well. If this is helpful, consider liking or subscribing. Take care. Be well until the next time.